Spinal deformity refers to any abnormal curvature or misalignment of the spine. One of the most common types of spinal deformity is scoliosis, which is characterized by a sideways curvature of the spine. In this detailed analysis, we will explore scoliosis, including its classification, causes, diagnosis, treatment options, recent studies, and research. Classification of scoliosis. Scoliosis can be classified into different types based on various factors, such as the age of onset, cause, and severity. The primary classifications include: A. Congenital scoliosis, present at birth, caused by vertebral abnormalities during fetal development. B. Idiopathic scoliosis, the most common type, with no known cause, divided into 3 subtypes based on age of onset. Infantile idiopathic scoliosis occurs from birth to 3 years of age. Juvenile idiopathic scoliosis develops between 3 and 10 years of age. Adolescent idiopathic scoliosis appears between 10 and 18 years of age. C. Neuromuscular scoliosis, caused by underlying neuromuscular conditions like cerebral palsy or muscular dystrophy. D. Degenerative scoliosis develops later in life due to degeneration of the spine, typically in adults over the age of 50. Causes and risk factors. The exact cause of idiopathic scoliosis remains unknown, although research suggests a combination of genetic and environmental factors. Other types of scoliosis have specific underlying causes, such as neuromuscular conditions or vertebral abnormalities. Risk factors for scoliosis include family history, female gender, as it occurs more frequently in girls, and rapid growth during adolescence. Diagnosis. Scoliosis is typically diagnosed through a physical examination, medical history review, and imaging tests. During the physical examination, a healthcare provider assesses the patient's posture, symmetry, and measures the curvature of the spine using the Adams forward bend test. X-rays, magnetic resonance imaging, MRI, or computed tomography, CT, scans may be used to confirm the diagnosis and determine the severity of the curvature. Treatment options. The treatment for scoliosis depends on factors such as the age of the patient, the severity of the curvature, and the risk of progression. The main treatment options include: A. Observation. If the curvature is mild and not progressing, regular monitoring with clinical exams and X-rays may be sufficient. B. Bracing. For moderate curves or in cases where the patient is still growing, a back brace may be prescribed to prevent further progression of the curvature. C. Physical therapy and exercise. Specific exercises and physical therapy can help improve posture, strengthen muscles, and maintain flexibility. D. Surgical intervention. Severe or progressive curves may require surgical correction, which involves spinal fusion, instrumentation, or other techniques to straighten and stabilize the spine. Radiological and imaging techniques play a crucial role in the diagnosis, evaluation, and monitoring of spinal deformities, including scoliosis. Here are some key radiological and imaging facts related to scoliosis. X-rays. X-rays are commonly used in the initial evaluation and ongoing monitoring of scoliosis. They provide a two-dimensional view of the spine and help in assessing the magnitude and pattern of the curvature. X-rays are especially useful in determining the Cobb angle, which quantifies the degree of curvature. The Cobb angle is measured by drawing lines parallel to the end plates of the most tilted vertebrae at the top and bottom of the curve. Standing full spine X-rays, to obtain a comprehensive assessment of scoliosis. Standing full spine X-rays are often performed. These X-rays capture the entire spine from the cervical, neck, to the sacral, pelvic, region. Standing X-rays allow for an evaluation of the spinal alignment, balance, and the flexibility of the curve. MRI, magnetic resonance imaging. MRI is particularly useful in assessing spinal deformities associated with underlying neurological or musculoskeletal conditions, such as neuromuscular scoliosis. MRI provides detailed images of the spinal cord, nerve roots, intervertebral discs, and surrounding soft tissues. It helps identify any structural abnormalities or conditions that may contribute to the development or progression of scoliosis. CT, computed tomography, scan. CT scans may be utilized in specific cases where detailed visualization of the bony structures of the spine is necessary. CT scans provide cross-sectional images of the spine and can help in evaluating vertebral abnormalities, particularly in congenital scoliosis. They are also valuable in surgical planning for complex cases or when assessing bony fusion after surgery. EOS imaging. EOS imaging is an advanced imaging technology used in the evaluation of scoliosis. It utilizes low-dose biplanar X-rays to generate 3D reconstructions of the spine, allowing for precise measurements of the spinal curvature and assessment of spinal balance. EOS imaging provides accurate and low radiation imaging, making it particularly beneficial for pediatric patients who require frequent monitoring. Surface topography. Surface topography is a non-invasive imaging technique used to assess the shape and symmetry of the back. It involves using specialized devices to capture 3D images of the torso, which can be analyzed to quantify the spinal curvature and detect asymmetries. Surface topography is often used as an adjunct to traditional radiographic assessments to provide a more comprehensive evaluation of scoliosis. Ultrasound. While not commonly used for diagnosing scoliosis, ultrasound may be employed in certain cases, such as in infants with suspected congenital scoliosis. Ultrasound can help visualize the spine and detect any abnormalities in the vertebral development. It's important to note that the selection of imaging modalities depends on the specific clinical scenario, age of the patient, severity of the scoliosis, and the suspected underlying causes. Radiological and imaging techniques, combined with clinical examination, aid in accurate diagnosis, treatment planning, and monitoring of scoliosis patients. The choice of imaging method is determined by the healthcare professional based on individual patient requirements.